Season's greetings, West Salem. Thank you for joining us here again. A couple weeks ago, Dr. Wolbrink and Mrs. Beth Clements came to you and we shared some information with you about where we were at that time and how we were making our decisions. At our school board meeting on Monday evening, we have made the decision that we want to have our kids back in our buildings. We have learned a lot more now and we're ready to do that. Prior to getting further into any of those things, I want to turn it over and we'll have some introductions here to start off with.
Hi, my name is Beth Clements, district nurse here at West Salem School District. I have children in our district as well. Pleased to continue to serve our school district.
I am Kate Bromer, registered nurse with the school district, and I'm happy to be here to help.
Hi, I'm Dr. Rose Wolbrink. I'm a family physician for Gunderson and live in the community, and I'm glad to serve the district as the medical advisor.
As some of you may know, we are so excited to have our students back in our building starting on January 4th. Obviously, this has been a long process to get here, but we've always gone off the premise that when we know more, we're going to do more. And recently, we've been working very closely with our county health department, local doctors from around the state and in our area, and also reaching out for information and data across our country. And based upon looking at what we have in our own community, in our own county with numbers, which as we've been tracking these have been slowly decreasing now for about a month. And that coupled with a lot of information that's coming our way, we know that now is the best time to bring our students back. We're not back fully like we want to be. Our goal is to have all of our students back within our district, in our buildings 5 days a week. But we want to make sure that we're making some steady progress going forward in order for that to happen. And we're moving in the right direction. And part of that moving in the right direction is that we're going to start following our own internal numbers. We're not going to go based on a county number or a municipality number. We're going to track our own data within our district. And we've updated our district dashboard with that. And there'll be some more information for all of you about how we're going to look at that coming up in this video here shortly. But I just want to make sure to let you all know that we're so excited that our students are going to be back. And I'm going to let Dr. Wolbrink and Beth and Kate, they're going to go into some of the background behind some of that decision and the data and the science that we've been using with that. So at this time, I'm going to turn it over to Dr. Wolbrink.
Thanks, Ryan. I think this is a very exciting time of year. Merry Christmas and happy holidays, everybody. We are really excited to get the kids back in school. Beth and Ryan and Kate have been talking tremendously with the staff about how to do that safely. We know now that the spread in the schools more mirrors what's in the community rather than driving the spread in the community. Dr. Todd Kowalski mentioned that on a recent meeting that we had with them. Oftentimes we meet, any combination of the four of us, with the Cooley Collaborative members as well as the other medical advisors in La Crosse County to go over some of the information that we receive. We get a lot of data, and going through that can be difficult because it all looks a little bit differently, but we use the Harvard model metrics that recommendations that come out, as well as the Brown University COVID dashboard, which gives us a lot of data points to be able to pull into regarding spread within the schools, spread to staff, and then the community rate and whether that mirrors it. So we've looked closely at that, and I think it's time to get these kids back in school. They learn better there, and I think it's a safe option. I'm really excited to be able to do it after the holidays. The one thing I wanted to mirror today, as we're all really excited to be celebrating, is that we really still need people to be really safe in the communities, and if nothing else, to make kids getting back to school a really good option and safest that we can. We all have priorities to look at, whether it's time with family or traveling, and I would ask one more time to just really look at those priorities and say, okay, there is a light at the end of the tunnel with this vaccine coming. Let's make one more decision, because holidays can be such a time where people are mingling and spreading, that we'd really like the nice lower curve that we've been seeing since Thanksgiving to continue. And that shows that our community is doing the right thing, because we don't see those numbers all over the country. So that's all I wanted to say. Just really keep up the good work. You're doing a great job, and happy holidays.
Thank you, Dr. Rose. I'll continue to echo that school nurses, myself and Kate, are involved with biweekly or meetings with other school nurses in our Cooley region, along with the La Crosse County Collaborative, both health systems, Mayo and Gunderson, and with the La Crosse County Public Health, in order to really look at these trends that are happening in our community. So we do have the pulse on our community and within our school. Something that I do want to just speak of is, while we have had students and staff affected by COVID-19, there had not been any infections arise from within our school buildings. And this is evidenced by our school district mitigation strategies that we will continue to use. Again, the goal to mitigation strategies is to create a Swiss cheese model. By layering multiple strategies can reduce the likelihood of linked transmission throughout the school day. Knowing that lapses in compliance can happen, but a multi-layered plan provides redundancy and protection measures to minimize the possibility of this transmission. So our mitigation strategies will continue. We ask our parents that they'll keep their children home when sick. We'll follow the isolation quarantine guidelines. Our school district will continue to follow the 14-day gold standard as established by La Crosse County Public Health for our schools, our students. The school nurses here in our district are using contact tracing principles, and in each COVID-19 case that will address the positive cases and the close contacts. So we do ask for your help in managing that, and that's why I asked Kate to be here today. She'll discuss that a little bit further. Families will continue to screen their students in the morning. Our staff will continue to screen themselves. Face coverings will be worn by all staff and students. And our school district has optimized ventilation systems, which have been in place since this summer. And then, of course, frequent hand hygiene and also social distancing and cohorting of our students, especially in our elementary school level. We're going to aim for 6 feet between individuals as much as possible for as long as possible. If everyone in the classroom is masked, maintaining a 3-foot distance is acceptable. And this is from the Harvard School of Public Health guidelines. The other thing that Mr. Reber was discussing was our district COVID-19 dashboard. It is live and it can be accessed on our website. This will give you a daily update of our staff and students who are unable to participate with in-person instruction. This is updated daily by 3 p.m. Monday through Friday. Our surveillance strategy will not be based on any one factor. There'll be many times we are faced with the possibility of shutting down a classroom or a sports team or a building, but there are many variables that we have to consider in these circumstances. There's not one data point that can decide this factor. And so what we will do is we're going to continue to use the data management surveillance system that we've used during our in-person instruction in September and October. While we have had COVID-19 infection in our students and staff, we've not had that evidence through spread in our buildings. So how will we watch for this? We'll continue to watch our community spread. We'll still continue to watch our municipality spread. We'll monitor our staff illness. Our school nurses will continue with our contact tracing of any sort of COVID-19 case or close contacts. And we'll track school-based COVID-19 cases and have a plan for contact tracing, like I just mentioned. And we are using this system to calculate the surveillance percentages each morning for each of our school buildings and our classrooms and our grade levels. This monitoring of percentages will act as a warning system. So if there is any potential spread of infection within our buildings, we'll be able to see that on a timely basis. So as I wrap up here and I offer it over to Kate to be able to talk a little bit more about that, we're going to continue with these same types of health protocols. I just want to remind everyone, get your flu shot if you haven't already, wear your mask, physically distance, wash your hands. And if you do have any symptoms consistent with COVID, to stay at home. I wish everyone a happy holiday. Thank you very much. And I'll leave it over to Kate.
Thanks, Beth. I just want to reiterate a couple of the things that we can do to lessen the spread of COVID-19 as well as other illnesses. It's important that you stay home when you're sick and to keep your student home when sick, even with a mild illness. As we know, COVID-19 can present in different ways in different people, and even a mild illness could be reason for suspicion. So when in doubt, keep your child home and reach out to one of us nurses in the school district. We are more than happy to help make recommendations and navigate this together. Another important consideration is that due to the overall escalation of cases in La Crosse County through the pandemic, case investigation and contact tracing efforts fall to us as school nurses. We are community health partners with the La Crosse County Health Department and continuously assist with quarantine and isolation guidance for those that are affected by COVID-19 in our school district. We need your help to continue to symptom track during any learning mode, whether it's online, in person, or blended. We will use this information, as Beth mentioned, in part to track trends and to make decisions about learning modes. This includes if you or your student test positive for COVID-19, if you are considered a close contact of a COVID-19 positive case, or you've been placed on a quarantine. It's very important for you to share this information with our school district. Again, in any learning mode, even online, it's important to continue to share your students' symptoms and COVID-19 status by reporting this to the attendance secretary in the school building that your student attends. So thank you, and very happy to be here, a part of the team to help you and your family, as always. Thank you.
I think one thing that we've heard as a common thread here is this isn't an individual task. This is going to take our community to continue to pull together in order for us to continue to move forward. We're excited at the fact that our doors are going to open on January 4th. And obviously, our doors aren't open for everybody yet, and we're not going to rest until we can open up our doors for all of our students and have all of our students back on campus. But it's going to take all of our collective efforts in order to do that. I do want to say a special thank you to the three ladies that are in this video with all of us. They've put forth a tremendous amount of effort and to make sure that when our kids come back, that our kids are going to be safe. And when I say our kids, I do mean our kids, because everyone on this call, along with all of you, we have kids in our district and we want our kids to be safe. And so they've continued to work hard to make sure that we're not going to take these steps unless we're absolutely certain that we have the protocols and the procedures in place in order that we can do the best we can to say that that's going to happen. From a district perspective, we are so excited that we're going to be able to have our students back in our walls and in our classrooms with our staff. Throughout all of this, I can't sing enough praises for our staff. Our staff have done a tremendous job with the fluctuation that they've had to go through with this and some of the uncertainties as well. So I want to say a thank you to our staff, because they're continuing to work diligently for our kids, and they know that they're putting our kids at the forefront of their minds and their decision making, because that's what our staff does. The Panthers are the best that we have, and I'm so proud of the Panthers that we do have. Lastly, I want to wish everybody a happy holidays. And I think this goes without saying, we're all looking forward to a 2021 and we can turn the page on 2020. So with that, I want to wish all of you a very happy and healthy holiday. We're looking forward to 2021 and can't wait till we have our kids back on January 4th. Thank you so much and have a great day.